This is Karen with NewClevelandRadio.net, and it is time for Heart Mojo with Melinda Smith. And Melinda, you have on a guest who you just informed me has been on before.
She has. I don't know how long ago, maybe a year and a half ago, the Cleveland East Senior Network Group, we interviewed our board regarding COVID and how it affected our businesses. And right now, I wanted to have Roberta back because her business is very, very important today in the medical world. And I think she deserved her own show. So this is all about her right now. So thank you, Roberta, for being on. This is Roberta Brofman from 5 Star Clinical. Tell us a little bit about yourself.
Sure, be happy to. And thank you again for inviting me. I really appreciate it. I do believe that this is an extremely important topic. So a little bit about me and how did I get started in this? Obviously, my name is Roberta Brofman. I am a professional nurse, registered nurse. I've been a nurse for many, many years. A little different as a nurse because my experience kind of runs the gambit, if you will, of healthcare experience. I've been an ICU nurse, where I really gained a lot of my strong footing in the clinical aspect of care. I've done home care for about 15 years. I've been in long-term care, post-acute care. I've been a director of nursing and a vice president of clinical services. And about 6 years ago, I started my company, which is called 5 Star Clinical Solutions. Initially started out as a consultant to hospitals and nursing homes, and I still do quite a bit of consulting to help them to provide the best quality of care they possibly can, do a lot of speaking and training and teaching. Then about 2.5 years ago, frequently I would, as a nurse, get calls from friends and family to say, what should I do? You know, this happened, or my doctor said this, and I don't know what to do or where to go. And I would help them out, and just what I did. About 2.5 years ago, my husband went into a large hospital in the area for what was supposed to be a minor surgery. It was supposed to be an overnight surgery. And of course, I stayed with him as his, as we call it, as his advocate. And right away in the recovery room, I could tell something wasn't right. And I brought it to their attention. They looked at him and they said, no, he's fine, don't worry. He went to the regular floor and it was clear that he was bleeding and no one would listen to me. He was passing out every time he stood up. He was in severe pain. The surgeon never came in for 3 days. His minions did, his residents did, but he never came in. And finally, when he showed up, I said, I'm concerned about him bleeding. I'm concerned about infection. And he looked at me and he goes, why don't you just stop thinking and just be a wife? And I thought,
condescending.
Yes, it was very condescending. And even at the time, though, I have to say that I thought, well, maybe he's just trying to put me at ease and everything is okay. But my clinical sense is very strong and I could tell something was wrong. About 5 days later, I finally had enough. And I demanded that he be transferred to the intensive care unit because I said he's infected. And they kept telling me, no, he's not. We don't treat what we can't see. And I said, well, maybe you can't see it, but he's really sick. The moment that he got into the intensive care unit, they recognized he was already in septic shock and he was bleeding. Yes, he almost had to be intubated. He spent a month in the intensive care unit. This was an overnight procedure, right? So a month in intensive care. I stayed with him continuously. The care there was excellent. They ended up, however, trying to find the source of infection. He had infection in his blood, in his urine, and in his abdomen. So, I was 100% correct. The surgeon still to this day can't believe that actually happened because it couldn't be him.
Of course not.
And right. And, not to be hyperbolic here, but quite frankly, had I not been there, he would have died. Even the senior resident was trying to talk us out of sending him to the intensive care unit. She said, you got a beautiful room here and the visiting hours are going to be so restricted over there. So one of the things that happened when he transferred is that people started to listen to us, right? Instead of me bearing the weight of all of this on my shoulders, they were listening. They were working with us as a team. It wasn't that we were calling all the shots. It was that we were bringing things to their attention. They were talking with us, and it was a conversation where we were part of the care team, which is what it always should be.
Mm-hmm.
I think part of the struggle, though, for the average person, you may be a brilliant attorney, right? You may be an amazing scientist, but you don't necessarily know the lingo of the hospital and of medical care. So even if I had been there, if I didn't have the knowledge that I have, probably things would not have gone well. And quite honestly, we were told that he would have died had he stayed there. I mean, we barely caught him in time. He came home a month later with lots of drains and tubes, and he was a runner before he went in, and he was barely able to walk by the time he got home. Now, thank the Lord, all the prayers that we said and all the good interventions and a great team that we had in the ICU. He came home, he's back to work, and he's doing great. But it was quite an eye-opening experience. And I think to myself, what would happen to people if they didn't have someone like me? And it made me recognize how important having an advocate, a patient advocate with you is. So, you know, I can tell you a couple other stories if that's okay.
Sure.
So another situation that occurred was a friend of mine who's actually a nurse. Her son had seizures. He's about 17 years old, had seizures at home. She called 911. He went to a local hospital and she called me. She said, I don't know what to do. They don't seem to be able to figure out what's wrong. It was during COVID. He did not have COVID. She was unable to get in to see him. Finally, we worked things out and she was able to be in with him. And this is a young kid who was afraid. And they couldn't seem to stop these seizures. Well, I said to her, you know, I want you to talk to them about transferring him to, he was in a Cleveland Clinic hospital, to the main campus, to the neuro-intensive care unit, and make sure it's neuro-intensive care. She said, can I do that? I said, yes, you can do that. You might get some pushback, but of course you can do that. She did, and it turns out that he was diagnosed there. There was a specialist there with this very rare autoimmune meningitis. Had they not treated it promptly, he would have had permanent neurologic damage.
Wow.
So, you know, just a few stories of how having an advocate that's knowledgeable with you, asking the right questions, empowering you with knowledge, and helping you to make good decisions with your care team is so critically important.
Well, it's equally important. I mean, having somebody like yourself who's a nurse who knows a whole lot of things that the average person doesn't. But I think it's also important for somebody who doesn't have the ability to get to you to at least have somebody with them as their advocate, right? I mean, somebody who can listen and hear the things that maybe you don't hear.
Yes.
Because I remember going through my cancer treatment. When I first started, I had 2 people come with me to every single meeting. Why? Because one hears one thing, one hears another, you hear a third. And I wanted to have the best outcome, and I wanted to make sure I didn't miss anything, miss any options. And I watched other people come in by themselves, and it's horrible. It's gut-wrenching to watch somebody go through a serious situation, any serious situation, by themselves.
100% agree with you, Melinda. And, you know, as we say, you hear a new diagnosis, whether it's something like cancer or it's, you know, you have high blood pressure, you have diabetes. And honestly, the physicians don't like what's going on either. Almost all of the physicians now, not all, but almost all are overseen by they work for the hospital setting.
Right.
So the hospitals set the rules, and I'm not trying to throw the hospitals under the bus, but our healthcare system is very complex. And a lot of these physicians are given 10 to 15 minutes per patient.
Right.
So now here I am, a patient, I just get this new diagnosis. My head is spinning. I'm not hearing half of what you just said to me, right? I leave, I have a question. I don't know. Have you guys tried to call your doctor?
You can't get through.
You cannot get through. Or if you get through, if you get a call back and maybe it's 2 days later and maybe your question's been answered, you went on Google and maybe got the right or wrong
Dr. Google.
Dr. Google, right? Yeah. You are frustrated. And, you know, honestly, I joke, if you're under 40, you probably don't know my reference, but am I breaking up here?
Yeah, you
A little
froze.
bit. Yep.
Well,
We can hear you though.
okay, I'll keep talking while I'm frozen there. So if you're under 40, you probably won't know this reference, but if you remember Marcus Welby, there was a
Yes.
TV show called Marcus Welby, MD, and this was a physician who knew your children, knew your parents. The most important part of that was the fact that you had a relationship, a trusting relationship with that individual. you are about to undergo treatment as you did, Melinda. You
Mhm.
have to have some confidence and you have to have some trust in the people who are
Caring
um,
for you.
that's right.
Absolutely.
And advising you, right? And advising you. So, it is essential that you have someone with you that has the knowledge and in whom you can provide trust.
Well, and I also think you have the right to not choose that doctor. So I will not work with a doctor who will not speak with me.
Mhm.
It's very important to me. I don't want to go in, spend 5 minutes with the doctor and then see his intern or his nurse practitioner the rest of the time. I really want you to be part of my treatment.
Right.
So in order to do that, I need to be able to speak to you, right?
Agreed. Yes.
Right.
So I
Yeah.
always used to call my pediatrician when I was a little kid, actually, he was a general doctor, grandpa doctor. That's how close we were to our doctor back
Right.
then.
Right. Yeah, I completely concur with you. And, I'm hearing a lot from there's such a thing as concierge medicine now. I don't know if
Mhm.
you're familiar
Yes.
with that.
Oh,
So
yeah.
there's a lot of physicians who are quite frustrated with the fact that they can't spend more time with their patients as well. And that's why they've gone into concierge medicine. Of course, not everybody can afford concierge
I was
medicine.
just going to say that it's quite
Right.
costly. You pay a fee, but they're available to you 24/7.
Exactly.
Well,
Exactly.
my question is, why do we have so many nurse practitioners? And I just went through this with my cardiologist. So I was given a diagnosis after a heart cath, told not to worry. My follow-up was with the nurse practitioner, who every other thing I said to her said, wait a second, I'm going to have to go ask him. And she'd run out of the room, then come back and give me the doctor's answer. And I said, why can't I see him? And she
Right.
said, well, he's busy. If you want to sit here and wait, you might be able to see him.
Yeah.
And to me, that's very frustrating because, like you said, I went home and I Googled, what my condition was. And I thought I was dying, and then I'm told, no, don't worry about it. It's not that serious.
Yes. But why should you have to have gone through the worry and the concern that you
Exactly.
did and not have the answers to the questions that you had right away? And, I think part of your question is, why do we have so many nurse practitioners and why is it that we have physicians running? Um, Part of it is that we're kind of reaching the trifecta, so Social Security, Medicare, Medicaid, running out of money, right? We have fewer and fewer physicians going into practice. We have a lack of nursing staff, right? COVID didn't help any of that.
Nope.
So the system is just struggling to try to figure out, how do we see as many people as we can, keep our noses above the water financially, and still provide the care that we're supposed to be providing. So, it is a very complex system that we live in.
Mhm.
And not only complex from the terms of, I don't understand what my doctor just told me, or I don't know what this medication is supposed to do for me, or is there a way that I can save money on this $1,600 a month medication, which we help people do too, to save that money. But how do I have a trusting relationship with somebody? I often have to go for a procedure, and they say nurses make the worst patients. I try to behave, but one of the things that is impressive to me is, let's say you're going to have anesthesia. You meet that anesthesiologist, maybe 5-10 minutes, never set eyes on this person before in your life, and you are about to be completely anesthetized, but you should put your full trust into this person. It's part of what we have to do. But it is so critically important how we interact with our patients, right? As a nurse with my own clients, it's extremely important how I treat them with respect, not rushing, answering the questions, extremely important. And I seriously believe that there are better outcomes as well when we feel confident in the people in whom we're placing our lives in their
Oh,
hands.
and I also think that if you're asking questions, the doctors now need to be more accountable, because you're asking the questions, you're getting some answers, and then they're like, wait a minute, well, they're asking me, well, then I better make sure I cover everything. Not that they deliberately don't, right? But as you pointed out, they have a small window of time that they're given by the hospital who they work for to finish talking to every patient that comes in. I think once they know that you're more into understanding what they're telling you, maybe they're more accountable for what they're doing.
Well, and to your point, as a nurse or as a physician, we talk about this stuff all the time. It's secondhand to us, right? So when I say, oh, you're just going to take this medicine, you had your heart cath, and it's going to be fine. You're going to be fine. For us, you're going to be fine. But for you, it's a whole different experience. And what we have to understand is we have to put ourselves in your shoes. What about you as a person? Have you had a bad experience before in a hospital? Have you, maybe you have a family member that had a heart condition that scared the heck out of you. You're bringing all of those emotions and all of that feeling to that encounter with that professional who has 10 to 15 minutes to talk to you. Do they really know all about you?
Well, and that's the difference between the Marcus Welby reference that you had and my grandpa doctor reference, who delivered my aunt and my mother and myself and my brother. I mean, he delivered all of those babies.
Yep.
They knew our family inside and out, right?
Yep.
No pun intended on that. But you know what I'm saying? Like, you don't know your doctor. They think, well, this might be my monitoring doctor, but you don't see him or her. You make an appointment. They're like, well, this doctor can't see you, but you can see this doctor.
Or this
they don't know anything about they don't know anything about you. They're deciding everything on that 10, 15 minutes they have.
Right. Well, and the other compounding problem is that we can do amazing things. We've progressed tremendously since the Marcus Welby era, right? We can do remarkable things. We can replace your heart valve through your groin. You go home 2 days later. It's amazing what we can do. We have all these specialists, but the problem is that nobody talks to anybody else. Or if they do, it's very minimal.
Nobody's monitoring all of these specialties to one person.
Exactly. And I have had experience in the same hospital setting with the same medical record where they have different lists of medications. It's like, how come, you're all in the same system. How can you not have all of my medications? This is with my husband, actually, and they were all different. So one of the things that we do with 5-Star Clinical as a patient advocate is we're the quarterbacks of your care, right? We help to organize who's seeing you, why are they seeing you, what are they putting you on a medication that's really for a side effect of another medication that they don't realize you're even on? Are you non-compliant with your medications because, you're on, let's say, Social Security, and your medication is $1,500 a month, and you have to eat this week, right? So this month you decided you're going to take half the amount of medicine. And what do we as professionals say to you when you come in and you haven't taken all your medicine? Well, you're being non-compliant. That's a problem. You really have to take your medicine like we prescribed it. Well, why are you not taking them? How about having a conversation with that person?
Right.
Exactly. And again, oftentimes we find that there's about a 7 to 10% chance you have with every medication that you add that you will have a side effect from that medication. So let's say some of these elderly people too are on, with comorbid conditions, are on maybe 20 medications, right? 15 medications, let's say. What are the odds that they're going to have a side effect to that medication? Pretty high, right? They're pretty high.
Absolutely.
So do we really look at what we're actually treating and why we're treating it? So, the other thing that we do is not just the crisis situation, but I have clients who live out of state, or maybe they work full time and they have young kids and they are not able to get mom to the doctor, or they live out of state. I have someone who lives in Alaska. She's a nurse. Her mother's 98. She lives alone. She's an amazing, lovely lady. But does she have food in her refrigerator? Was she able to get to the doctor's visit? We can go with people to their doctor's appointments, help them through that, answer their questions. We do a physical assessment each time we are there. Had that same lady checked her blood pressure, was sky high. She would have had a stroke by now had we not intervened. So, it took a little doing. We talked with her physician, no problems. But she was so grateful and also thankful that I have started a rapport with her mother, and her mother does trust me. So, and planning for the future, we do an individualized plan of care for each patient, each client, so that if they, let's say this lady is 98, does she have something in place? If heaven forbid she should fall, or she should have some sudden reason to go to the hospital and cannot go home. How is she, what is she going to do? Where is her placement? Where is she going to go after that? Leaving that up to chance is not smart, as you know,
Well,
Melinda.
I deal with that every day, right? In my
Right.
day job, but I'm not
Yes.
podcasting,
Right.
is
I know.
helping seniors move into community like assisted living and memory care or independent living or even nursing home care. And
Right.
most of these are not planned out.
Mhm.
Most of these are an emergency situation that happens and they have to find a place and they have to find it now. And they're not prepared. They're not prepared financially. They're not prepared with all of the paperwork items, the POAs and anything like that. They're just not prepared. So it's really important that people start to think of those. Now, me going through my cancer treatment, of course, I had to have those things. I had no option at the time. So I'm glad I have those things in order. But so many people do not. So that's another way that you can help them, right?
Absolutely, 100%. Yes. And it is amazing to me how many people don't have those options in place. You know, I always say maybe right now you don't need memory care or you don't need long-term care, but let's have you on a waiting list. Let's make sure that even if it comes due and they say, hey, we're ready to take you in and you don't want to go, that's fine. Not a problem. But not having that option leaves you to go to wherever is open, and that, as we all know, that may not be a good option for you.
Well, and it's also the pricing of it. Like you have to know what you can work with in your budget.
Yeah.
We spend a lot of time planning for our home or buying a car or all of those things, but we don't really plan for our health and our care later in life. We don't do that at all. It's like that doesn't exist for most people.
Well,
Yes.
sadly, too many people believe, Medicare is going to take care of it, and Medicare does not, as a good majority of us know. Or it's, oh, well, don't worry, I'll just put my parent on Medicaid. Well, you just can't put them on
Right.
Medicaid. And even on Medicaid, not everything is going to be covered. I mean,
Well, or you
these-
may not go where you want to go. I mean, the
Exactly.
bottom line is you go where they take Medicaid
Mhm.
and what's
That-
affordable. And that may not be the place you want your family
Exactly.
member to go to.
Exactly. Well, and once you, even when people are, need to be in long-term care or post-acute care, sometimes, I had one client, all of a sudden, woman just became very confused. I think that was happening over time. She was living with her sister and she got violent. And so she had to go to the hospital. She had to go to long-term care. She went to memory care. And, they had no idea that what their rights were, what they were
Right.
entitled to. This woman, unfortunately, there was supposed to be a plan of care conference. They didn't know what that was. They hadn't had this for like 2 months when I finally got involved. The woman had been abused by other residents like 3 times. When I went to visit her, it was dark. It was awful. There were no activities for her. We got her transferred to another location, which was closer to family. And they sent me some pictures afterwards, and it just did my heart so much good because she looked like a completely different person. She was so happy and looked wonderful and was enjoying her life, even with some severe memory care issues. They provided her a wonderful experience there, and she was safe and she was near family, and it was just a win-win for everybody. So, all good things, all good things.
So when you're in your business, how do you end up connecting with your, I want to say residents because I work here, but no, with your patients? How do you connect with them, your clients?
Most of it is through networking, like with people like yourself, Melinda, references, and from people that I've worked with already. I had a gentleman who called me, actually one of our colleagues referred this person to me. It was the son-in-law of this gentleman. He needed a lot of coordination of care to move from different places. And then once he was in the hospital, he was having some trouble. And we weren't clear that everything had been done that he was kind of at end stage heart failure, quite honestly. And he had lived a different kind of lifestyle and had not really been compliant with some things, which those were his choices. That's fine.
Right.
But it became clear what we needed to do first was we needed to make sure that every stone had been turned over, that this family and he recognized that there was no more that they could do. There was no surgery, there was no intervention that they could do that was going to save his life and make the quality of his life better. So we went through that process. And then for me, it was gratifying to help them to get to that point where they understood he needed hospice care. And oddly enough, I went to go visit him in the hospital. He got transferred to a LTAC, long-term care, acute care hospital. And he was asking the doctors, isn't there more that can be done? And it was very clear he was at end stage. And I'll never forget that he reached out to me and he took my hand and he squeezed my hand and he thanked me. And we had a conversation about, this is hospice. He thought that maybe we could pound on his chest if he needed it. And I said, I'm just going to say Jim, but that's not his real name. I just said, Jim, that's not gonna do it. You need to come to terms with your family and with your life. And he did at that moment. And oddly enough, the following morning, his son-in-law called me and said he had expired.
Mhm.
And I felt sad about that, but I also felt good about the fact that he didn't die being pounded on his chest and no options for him. He made his peace and he made that comment to me, it's time for me to make my peace. And he did. And to answer your first question, his son-in-law has sent me several patients because of that experience. Because he trusts me, because he knows, and that's the first thing that I have to do is first, our first consultation is always free. I usually spend about an hour with a family or a client or both and discuss what their needs are to make certain that what we offer at 5-Star is something that we can accomplish for them. I don't want to overpromise and underdeliver. I'd rather do the opposite. So once that's completed, they have different ways that they can decide to retain me. Or if they want to pay for an annual program, it's on our website, which is 5starclinical.com. So they can take a look at an annual plan that includes different things like transportation to, the doctor's visits, review of their medications. We do a quarterly cognitive assessment, home safety evaluation, references or referrals to people like yourself, Melinda, if there needs to be placement,
Mhm.
to physical therapy, home care, whatever is necessary. So, after we have that plan of care meeting, they need to have trust in me. And that's when the rubber hits the road, if you will. Do I call them back? Yes. Do I answer their questions? Do I show up when I'm supposed to? Yes. And the people that work with me are people that I know personally. They're not somebody I hire off the street. They are people that I know very well, that have the skill set, that follow up with things, because that's our reputation, my reputation, right?
Absolutely.
So you really are the Marcus Welbys of today.
Yeah,
And
I say yes.
so do you see your type of business growing because there is such a need? I may know certain things about my health, my husband's health, but there's no way that I'm going to stand there and tell a doctor, it's wrong unless I absolutely know it's wrong. But there aren't enough of you out there, that,
Yes.
can fill this need.
Yes, I agree with you. And I do see this business growing tremendously. I think one of the challenges is getting the word out there as to what we do. There are, and there's nothing wrong with them. There are many placement options. So people think about, mom needs to go into a nursing home, or I need to get home care. Then there are people that can help you with that. But our services are all inclusive. It is the Marcus Welby. It is that trust. It is that one-on-one rapport and relationship that you develop with that client and with their family. That is so, so critical. And it takes time. It takes time. And it is one of the parts of nursing that I like the best and always have liked the best is home care. And the reason for that is because it is that one-on-one. I see you in your environment. We may have you at rehab And there's nothing wrong with rehab, so I'm not throwing them under the bus. It's necessary, right? I teach you how to go up the little steps. I teach you how to get in and out of the car. But now we're home, and I see that you've got throw rugs that slide all over the place. I see that your staircase has a bunch of papers on it that you could trip on. I see that in your bathroom, there's no rubber mats on the floor. There's no grab bars. I see you in your environment with your family that covers with for your memory issues, right? I see all those kinds of things, and it helps us to be able to really personalize that care in a way that you cannot do in a hospital or rehab facility. Are they necessary? Are they wonderful? Absolutely. And there comes a time when a person needs that. But until that time, we can provide that really personalized, individualized care.
Do you feel that when you show up at a hospital that you get pushback because you're not exactly a family member coming in telling them what to do?
Yes and no. It's a very good question. So one of the first things we do after, we have our consultation, which is again about an hour, which I do not charge for, is we have some agreement forms that are signed because I want to know exactly what do they want. We develop that plan of care, and we also have a HIPAA release that's signed. So interestingly enough, there are some places I can call and they should be asking me, for that HIPAA release, and sometimes they don't, but almost always they do. And I have that at the ready to fax to them. I will tell you that one of the major hospitals, I have a client right now who's in a nursing home who is not getting good care. It's a long story, but the bottom line is that I called the primary care physician to find out if he had an endocrinologist see him because he has some hypotension. In other words, his blood pressure drops when he stands. So he's been to cardiologist, but one of the things that I know is it could be endocrine related. Okay. And I wanted to know, has that been done? Because what's happening to this gentleman is he's lying in bed all the time. He doesn't want to get up. He doesn't want to do therapy. His muscles have wasted. He's actually getting contractures in his knees and his elbows. And he's only like 62 years old, so not that old. Seems like it's getting younger every day, right?
Definitely.
Right. So, in the meantime, he can't stand up and tolerate therapy. So I'm trying to get an answer to this question. And I ran into a nurse at this primary care physician's office that refused to give me information. I faxed her the HIPAA release. She says, I'm going to have to talk to our corporate offices. This has been a month and a half, and I'm working with an attorney. I do work frequently with elder law attorneys. They do the legal piece and I do the clinical. And we still cannot get an answer to our question. We had to fill out all these forms. And, then they said, well, you didn't have the address on here. What difference does it make? He signed it. He signed it twice. It says we can have this information. Our name is on it. So in answer to your question, yes, sometimes we do get pushback. Most of the time, no. Most of the time, it's not a problem. As long as we're able to, provide that HIPAA release. And that's very appropriate. It's not okay for somebody to just simply call up and ask for information. I am oftentimes placed on the list for contacts in a nursing home or memory care facility, so that if I call or the family wants me to talk to them, it's okay. They don't have to go through the whole HIPAA release thing, but generally they'll put it on the chart. I also send a letter to primary care physicians, letting them know, who am I? Why am I retained? What am I doing here? If I show up for visits or if I contact their offices, and also include that HIPAA release too.
Yeah, I could see that. I can't even get information on my kid, and it's my kid, right? He turned 18 and suddenly you're out. You can't get any answers. So I imagine that they give you a hard time when you're not actually a family member.
Well, and since you bring that up, Melinda, because my son was moving out of state, we made sure that he had everything in place. I mean, we had to do this very, very quickly. But he moved to New York, and New York doesn't accept the filing here in Ohio. So everything has to be redone for New York. So it's something to think about. But our big thing was, God forbid, if he were to get sick, he doesn't have a significant other. They normally wouldn't talk to us. Now that part is okay in New York, but if any life-saving procedures have to be done, our right. We don't have the rights.
Yeah, it's absolutely something to think about. All you also think, and this is a little bit off topic, but how about passwords?
Yeah.
Maybe
Right.
your child doesn't want to give you those, but how do I get into, any of your social media or even your email? And having that HIPAA release or a living will or any of that kind of stuff is really important. No
Yeah,
question.
people don't even think about the passwords though.
Yeah.
Again, that is something that I put together just because when I was sick, I thought, oh, what if they have to pay a bill? What if they have to get in my bank account?
Right.
So, and I kept myself, not on my oldest son's, but on my younger son, I've stayed on his bank account so
Mhm.
that he, I have access to help him because he has a lot of health issues if he needs it.
Right. That's very smart. Very smart. Yeah.
So if you were going to leave parting words, because believe it or not, our time's almost up. It goes really fast when we get in these topics. Because what you're doing is helping people with the challenge and navigating the maze of healthcare. Really, that's what you're doing. And so what advice, what would you put out there to anybody who's saying, hey, I need to reach out, say they're not directly in this area. How do they find someone like you?
Well, you can find us on our website. That's 5starclinical.com. I always say that health is your most valuable asset. I bet if I asked all of you, would you rather have, more money in the bank or would you rather have your health? You're going to say you want your health, right? Yes, we don't want to be on the streets, but, we do need our health. So
Right.
check us out on our website. Again, 5starclinical.com. There are many options there that you can take a look at, and you can reach out to me directly on there through my email, which is Roberta@5starclinical. And also our phone number is there, and you can send us an email to ask any questions that you'd like. And we do a free 1-hour consultation just to make sure that we can provide the services that you need.
Mhm. If somebody's out of state though, would you be able to maybe push them in the right direction? Because we do
Yes.
have a lot of our viewers are out of state, so.
Yes. Interestingly enough, I got a referral from a physician that is out of state who was helping a client here in Ohio. And she felt that it was getting too complex for her. So she handed that client over to me. Also an interesting story, I'll be brief, but the gentleman had done everything right with COVID and went to his doctor's office after getting 2 vaccinations, wanted to get a flu shot, hadn't gone anywhere, contracted COVID 3 days later, ended up on a ventilator.
Oh my goodness.
The doctors at the LTAC that he was in told the family, give up, here's hospice pamphlets, because he's, every organ system's failing. We
Mhm.
got involved. It turns out he's not dying. He is now in a different facility. He is off the ventilator. He is eating, he is walking, he is talking, he is alert
Oh
and
my
oriented.
goodness.
Yes. So some things can be managed remotely. I've also had clients where the daughter may live in New York and they want mom to live with them. So I've given them references to find locations out in other states.
States.
Mhm.
Very good. Well, this is a topic that I'm sure we could talk about for another
Absolutely.
45 minutes or more. But I wanted to put this out here because I felt I watch this every day, and you do too in our profession. And so I felt this was important for somebody to start to look at. So they may be listening to this show today and they've never thought about it. Well, now's the time before it's too late.
Yep.
Absolutely.
Like I say, healthcare is your most valuable asset. And if you just have questions, I'm happy to be here to answer those questions. Maybe you don't need more than that, but I'm happy to be here to help.
Well, and if anybody's watching this and they want a good speaker, she's excellent. She's done it many times for our different groups in the senior care industry. So if you're looking for a speaker, she's really good at that too.
Thanks, Melinda.
Thank you. Thank you,
Thank-
Roberta, for being on. I really appreciate it.
Thank you. Appreciate your time.
Well, thank you for bringing this out today because there are so many people out there, like you said, Melinda, that need to know that there is a life jacket that they can grab onto. So I hope that we will answer the question for many people. And
Yep.
with that, have a great day.
Thank you. Thanks,
Thank you.
Roberta.
All right.
Bye-bye.
Thank you much.